Hi, this is David Bishai with part 2 of our lecture on health insurance. In this part of the lecture, we're going to cover basic insurance concepts, the definition of what a premium is, what an indemnity is, what a copayment is, and how the system works. So let's start with the idea that we have to start our own insurance company. How would one go about starting an insurance company? Well, the first thing one would do to start an insurance company is form a group. This is the trickiest part. You have to pay a recruiter to gather a group of possible customers into the group. So step 1 is done. Step 2 is to pay a retailer to go to each member of our group and sell them the tickets, the little slips of paper that say you are insured, and collect the money. So the retailer is going to hand out all of these ID cards to the customers. The ID card is going to have the name of the customer on it. It's going to say that Joe paid a premium, and in exchange for the premium, the insurance company will pay blank, and that number is a percentage of the qualified expenses. And look how I've expressed it. I'm calling it 1 minus a copay. The copay is the part that the customer pays. The customer pays 5%, 10%, and the insurance company pays the other 95% or 90%. So if the card says Joe paid a premium, insurance will pay 90% of the qualified expenses. Okay, now, after step 3, our insurance company has millions of dollars in the bank. Are we going to leave it in the bank? No, we're not going to put it in a paper bag. We're going to take these millions of dollars and buy stocks and bonds on Wall Street. And we're going to rack up returns of our nest egg in our bank while we go to step 5. Step 5 is that claims come in. Our customers are getting sick, and every time one of them gets sick, they send us a claim and says, you have to pay the doctor now. So the billing whiz in step 6 is going to challenge the claims, because we don't want to pay out right away, being cynical. You want to get as much time paying the doctors in the hospitals as possible so that we can keep the money on Wall Street for as long as possible. After however long we can possibly delay the payment, then we're going to pay the claim and keep our business going. So the key to focus on here is at step 3, insurance is a contract. It's a piece of paper with a promise on it where a customer gives out money and the insurance company promises to pay claims. So insurance is a contract. I want you to think about it in physical terms like a piece of paper. And it says, in exchange for the premium paid by the customer, the insurance company will pay 1 minus copayment % of qualified medical expenses. And now you're seeing some notation. C is the copay. Qualified medical expenses of person I, with that subscript I, qualified medical expenses are what forms the substrate for the indemnity payment. So here comes a bunch of definitions that you'll want to remember. First is what is a premium? The premium is the amount of money paid by the customer to the insurance company to purchase this contract. That's the price of the contract. The indemnity is the amount that the insurance company has to pay out in claims, and it's going to be 1 minus the copay times X. The insurance company is responsible for 90% if the copay is 10% times X. The copay is when there is a claim. A part of the claim will be paid by the patient. That's the copay. A deductible is a little bit similar. A deductible is the amount that the insured person has to pay out of pocket before the insurance coverage begins. If it's a per event deductible, it's the same as a copay. If every time you see the doctor, the deductible is 10%, that's really a copay. Usually when we use the word deductible, it's going to be an annual deductible. You get your insurance contract starting on January 1. The deductible says the first $1,000 is not covered. And until you've proved to the insurance company that you've paid out of pocket $1,000, you're not insured. You pay the first $1,000, and an annual deductible puts the customer at full risk for the first $1,000, however many dollars the deductible is for the payment. So these are some of the definitions that we'll be using. Now, fundamental equations in health insurance are covered here. The total revenue of any insurance company has to equal the total expenses. If the total revenue is less than total expenses, what happens? Insurance company has to go bankrupt. They have to cover their expenses with their revenue. So the total revenue of an insurance company is the sum of all the premiums they've collected, symbolized by the sum of P sub I. If everybody pays an average premium of P, if N people are paying P bar, then N times P is the same thing as the sum of all the premiums. But typically insurance companies have multiple different levels of premiums for the different groups that they insure. So on the revenue side, we have sum of all premiums. On the expenses side, the insurance company has to spend out its net indemnity, which is 1 minus the copay times the claims, plus a loading charge. Loading charges are the cost of doing business, to pay their rent and pay their billers and coders. It's the amount they pay for their electricity. So the insurance company has a loading charge added to the money going back out to the customers. If they didn't have a loading charge, they couldn't have any building to operate in. Now, very often we will model the load as proportional to the amount of money going in and out of the insurance company. So if we believe that the load is lambda times the amount of money going in and out, the amount they pay for rent and labor is proportional to the money moving in and out of the insurance company, that's a good model. And so we would go back and rewrite this equation as 1 plus lambda times 1 minus C n times x bar. If the average indemnity payment is x bar, total expenses are 1 plus lambda times 1 minus C n x bar. So here we can express the fundamental law of insurance. Same ideas that were here, we're going to express them again as the revenue has to be equal to the medical expenses plus the total load. It kind of has to be greater than medical expenses. And it can be greater than medical expenses because there is risk aversion and people are willing to pay more than their medical expenses. They're risky, time uncertain medical expenses. They're willing to pay more than those in order to have smooth flow of expenses. And so the revenue can be more and it will be more. And that's how the insurance company makes a profit. The profit's included in the total load as well. So the sum of all premiums has to be equal to the sum of all indemnities. Rewriting this in the notation from the last slide, we could say the sum of all premiums divided by the number of people. The average premium has to be greater than the average medical indemnity. So final sentence says the average premium has to be greater than the average indemnity. Otherwise, the insurance company goes bankrupt. So insurance companies really, to do their business, they really want to be able to predict their expenses next year as well as predicting their revenue. So they want to predict X bar. Now, they hire epidemiologists and actuaries to try to predict X bar. X bar is the average amount of medical expenses in the company's insured population. And it's really driven by two components. How likely is the probability of getting sick in their population? And if one of their insured customers gets sick, what's the average cost if they're sick? So X bar can be decomposed into what's the chance they'll get sick and what's the cost of getting sick. I sort of assumed away the probability that the customer will or will not actually go to the doctor or not. So there have been circumstances, in the year 2020 is a great example, where people are still getting cancer and heart disease and headaches and broken legs, but they have a reduced chance of actually going to an emergency room because of fear of the coronavirus. But on most common years, the probability of going to the doctor if you have an insurance plan stays the same from year to year. Okay, so now that I've defined the fundamental rule of insurance, let's go over this concept of an actuarially fair premium. The actuarially fair premium is the average value of the indemnity payment. So for a population of n insured people, 1 minus C, the sum of all indemnity payments divided by n, is the actuarially fair premium. Another way to write it is 1 minus the copay times the average indemnity. So insurance that charges the actuarially fair premium will pay out all of its revenue to the customers, and it has no load. So an insurance company that typically charges a load. So what we mean by actuarially fair is a fair to the customer, that they are getting every single dollar back out in indemnity payments, and the insurance company has no money to hire its staff or make any profit. Furthermore, this is an actuarially fair premium would be a premium that a risk-neutral customer would want to pay, because from a risk neutrality perspective, every dollar the population is putting in is coming right back out to it, and the population doesn't actually have to pay the risk premium in this setting. Now let's say a little bit about what that insurance load is doing. If you are an insurance company, you have to pay people to be your own business. You had to pay the marketer to get your group together. You had to pay the retailer to go and get the money from everybody in the group. Of course, you had to have the financial wizard investing your money in stocks and bonds. And you had to have your billing specialist who was going to actually go to the hospitals and doctors and deny claims and delay and then pay. So we've assumed already that these loading expenses for all of these services are proportional to the amount of money going in and out of the company. So we've used lambda as the loading factor here. When we observe this, that the premium is 1 plus lambda times the actuarially fair premium, we have to remember that the actuarially fair premium is the premium that would be charged if the load were $0. But we also have to remember that this never happens. Insurance companies actually have to pay people. And if it's a for-profit insurance company, it's going to have to scoop off money for the capitalists that started the company. The capitalists bought the building and paid for all of the startup costs for this insurance company. So we will never see in the real world an actuarially fair premium being charged to customers. We only see loaded premiums. Now, in a very fundamental way, the load is the quote-unquote cost of insurance, meaning the cost of moving the money from the customers back to themselves. That act of taking money in, parking it, and giving it back is a service to people, and that cost of insurance is paid for in the load. If this were a bank, you would get it. You would say the bank would have a cost of taking your money in and giving it back to you, and they're taking that off of your interest rate, and they are finding their own loads. The cost of administering these financial instruments isn't zero. So lambda is one place to see that actual cost of health insurance. So if you want to actually see it with your eyes, I've taken this picture of the Hartford skyline. Hartford, Connecticut is the home to almost a dozen different insurance companies. And these skyscrapers over Hartford, Connecticut are full of claims analysts pushing paper back and forth, fraud detectors, cost controllers, marketing reps, and financial investors. So this image is the cost of insurance. All right, so let's go on to a quiz, and when you come back from the quiz, we'll go over what we think of it. So in the quiz that you just took, you noticed that Company C involved individuals that came from two prior companies, and in their own companies they paid different premiums, but when they were merged they had to pay, in one case a higher premium, in one case a lower premium, and the people who came from company A with the lower premium are now forced to pay a higher premium to enjoy solidarity with their sicker new members from company B. What we saw in the quiz is called community rating. The company C chose to give all of its employees the same rate. We can extend that type of insurance payment system to whole states, whole nations, whole communities. So an experience rated plan would have kept each new member of the company C and found a way to discriminate against them and give them payments that were different, and they would have been rated on their past experience of being a sicker population. Whereas a community rated would not discriminate, would not try to find out anything about these pooled individuals, and set their premiums based on the universe of all groups. And in that universe, there isn't a sick and a healthy population. There's one population of 2,300 people with a new pooled rate of getting sick and their indemnities. So when we talk about the pros and cons of experience and community rating, there's goods and bads over each type of system. The good thing for experience rating is that no one gets to complain about, why do I have to subsidize your costs? You're not like me, you're different from me, and you minimize that feeling of unfairness. But not everybody feels that unfairness. Due to different types of culture, some people feel good about solidarity and they want to embrace each other as people in the same risk pool. There's no sense of you are separate from me and I don't care about you. So there are pros and cons. We'll come back to discuss even more experience versus community ratings, pros and cons. It keeps coming back to the sense of culture of who is in the group, but it requires that individuals be able and willing to embrace each other as they are forming a club or a social group to solve a problem. Now, what we've been talking about in class is an American version of insurance, where people bought insurance in groups. And it doesn't have to be that way. Individual insurance markets are still out there, and in an individual insurance market, the contracts are sold one at a time to individuals. There's no community, no group of any kind, and the insurance company would just look at everybody one by one who comes in and buys insurance. So group insurance is much more common. We'll talk about why in just a minute. Group insurance is like the insurance for Johns Hopkins employees. The Johns Hopkins University is a group. The Baltimore County Farmers Association is a group. The employees of Joe's Pizza are a group, and they would buy employer-based insurance. Now, the advantages of group insurance are that you get to pool people with different sorts of health status in the pool. That's great because that's the whole point of insurance. By adding people to the pool, not everybody gets sick at the same time. We want to have larger pools, and if you're only one person in the group, then you haven't been able to spread the risk. There are lower administrative costs as the size of the group increases, and we'll go over those in detail later in the course. There's that fixed cost of your skyscraper, and your information technology gets to spread over many, many more people. The larger your insurance group, the more bargaining power you have to set prices when you go and negotiate with hospitals. We'll say a lot about that. Big insurers get to push around the hospitals and the drug companies. And there are fewer underwriting costs because the larger and larger the group, the more predictable the medical expenses will be. The advantages of group insurance is that the information is more reliable about what will be expected in the group, and the larger groups are able to communicate expectations better about what the premiums will be and how the system will work. So group insurance in America has always been employer-based insurance, but from an economic purpose, doesn't have to be workers. You could have a random collection of people with varying health that all get together and buy insurance. So a church group might do, a labor union might do it, a business association might do it. Anecdotally, the reason we set up health insurance through employer-based had to do with coming out of World War II and having employers realize that they couldn't compete in the labor market because they couldn't bump up wages during World War II. And so they started to offer health insurance plans as a way to compete during the war to get workers to come and work for their firm. So it was a way to get around a wage freeze by offering up these fringe benefits, and it kind of stuck. As employers got used to offering this benefit, they kept on doing it. So that historical pathway is stuck with the Americans in terms of how they offer their health insurance groups. So we'll end part 2 there, and we'll come back and talk about part 3, which will be about moral hazard.